Hey all, welcome to ShareTrekc. This is Raj here, and it's a historic day. We got news this morning that United Kingdom Medicines and Healthcare Products Regulatory Authority, or MHRA, has granted conditional authorization for marketing of Casgevy, Casgevy, which happens to be a brand name for Exa-cel. And this news comes to us from VRTX, which is a partner for CRISPR Therapeutics. And I'm going to talk about that today. I have a few thoughts that I want to share with you, and I also want to get your feedback. So let's get started. Welcome back, friends. In the United Kingdom, Casgevy has been authorized for the treatment of eligible patients 12 years of age and older with sickle cell disease, with recurrent VOCs or vaso-occlusive crisis, which happens to them on a regular basis, or patients suffering from TDT, for whom a human leukocyte antigen HLA-matched related hematopoietic stem cell donor is not available. In other words, this is not the first line of treatment, but this is the subsequent line of treatment. There are an estimated 2,000 patients eligible for Casgevy in the UK. And as per reports in two global clinical trials of Casgevy for SCD and TDT, which we know as Exa-cel, their respective primary outcome of becoming free of severe VOCs or transfusion dependence for at least 12 months, 12 consecutive months was achieved. So what that means basically is that prior to getting Exa-cel, if there was a kind of a treatment where a stem cell transplant was done, where the entire bone marrow was cleared and a new stem cell was put in, whatever was the quality of outcome out there, something similar to that was observed here. And this is very important because Exa-cel still uses busulfan conditioning to empty out the bone marrow and put the new cells in place. So I have spoken about it at length in my earlier video about how Exa-cel works. So these are supposed to be lifelong changes. So all the improvements that the patients felt after going through a treatment with Exa-cel were observed for 1 year, and they were free of symptoms. But Exa-cel expects this to be a lifelong change. So it's a once and done therapy for sickle cell disease and TDT. In our channel recently, I made a video explaining exactly how Exa-cel works for both TDT as well as SCD. You can check it out. Just go to our channel and search for Exa-cel. And a total of 97 SCD and TDT patients have been treated so far, and the data has revealed a safety profile generally consistent with myeloablative conditioning with busulfan and hematopoietic stem cell transplant. So basically, if VRTX and CRISPR were to come up with a gentler conditioning regime, then the outcome would be even better in terms of better patient experience, because going through busulfan conditioning is not a very pleasant thing for any patient, and that makes it a very invasive treatment. So today was a bad day in the market for most genomic companies in our watch list, but among our watch list companies, CRISPR topped the list with a gain of 5.23% and closed shy of $60, just around 59 point something. So now if you look back at the past, even as recently as 1st of November, the share closed at around 43.77. So it's understandable that the market opened at a high of 58.06 today for CRISPR on the news of UK approval of Exa-cel branded Casgevy. However, those that may have bought it at around $43 at the start of the month possibly started taking profit, and also those who bought at a lower price and had been waiting for months probably took profit, because the share price immediately fell down to 55.76, and then it bounced right back to close at around 59.22 but at the end of the day. But before that, intraday, it had crossed $60.41 at one point of time. So that's really, really promising. And I think that when it comes to genomic companies like CRISPR and all, as they start becoming valuable, there are going to be many people taking profits and selling out. So the upward movement is not expected to be straight. It's going to be zigzag, with a lot of people taking profits and exiting the portfolio, while the long-term investors start coming in. So in anticipation of approvals, I had compiled the history of Kymriah, which is a gene therapy from Novartis for cancer. I traced the development timeline right from when it was in preclinical all the way up to the first approval of Kymriah for the first type of cancer, and their cost estimates, and compared that with ICER estimate, and then their sales data since approval. I think I had 3 or 4 years of sales data. The idea was to give us some basis to visualize how Exa-cel may perform. And since Novartis is not a one drug company, it was difficult to do a stock price to Kymriah correlation. So I couldn't do a Kymriah sales correlation to the stock price of Novartis because they had multiple drugs. And I think that we should soon hear from CRISPR and Vertex about their treatment centers and how they plan to handle the process. Exa-cel is autologous and just like Kymriah. And if you had seen my video on Kymriah, what I had said that out there was that Novartis went around and had tie-ups for manufacturing Kymriah in various parts of the world and also to deliver it to the patient. So Vertex will also need to tie up with manufacturing partners across the world and set up treatment centers to collect patient T cells and then infuse them. And they also need a manufacturing facility in each geography to quickly and reliably and safely turn around the modified T cells back into the patient. This makes me think that we should look at those companies that have capability to do these kind of operations, edit operations on the T cell, and have good manufacturing practices in place and are an approved facility. I think those companies will be in increasing demand as this treatment grows in number. So we already have Kymriah, we have a few other Yescarta and a few other gene therapies already in the market. The autologous ones, I think, are going to be easy pickings in the beginning because allogenic is a difficult task. But there are many allogenic treatments also coming up. But for those autologous treatments, it's going to be increasingly difficult for manufacturers to deliver it to various parts of the world. And therefore, they need nearshoring of manufacturing capability. And so I am thinking that one of the things that could happen is we may have an emergence of companies which have got absolutely strong capability in genetic editing of T cells and various cells in order to do the edits that the patent holders ask them. So that it becomes the patented product and can be delivered. And those facilities will have to be approved by FDA and all the regulatory authorities and should have good manufacturing practices in place to reliably, safely, and consistently deliver on a time schedule to the patient. And Kymriah has seen Novartis make many such tie-ups until such time that we do not hear about those facilities from either Verve or CRISPR. I think it will be premature to expect revenue. Once the approval is received from FDA, the market focus will shift to first revenue from Exa-cel. So right now, I think the focus is still on FDA giving approval for Exa-cel. And as soon as the approval comes, we'll see a spike, and then there'll be profit taking and it'll start moving sideways. And then the anticipation will be, okay, let us look at the sales number. How many patients have signed up? And Vertex being a multi-product company, it will be difficult to correlate the sales of Exa-cel to Vertex stock price, but CRISPR does not have many products. It doesn't have any products. So exactly when they start getting revenue from sales of Exa-cel will determine when the share will get a sustained boost. So we have to watch for that. However, in Q4 earnings, like in Q4 2023 earnings, if they were able to announce the FDA approval and also give details about when the first patient will be dosed and what the price of the treatment will be, what arrangements they have in place with the payers, and also if they plan any performance-based pricing, those kind of things will be good. However, it's my understanding that that kind of information will come from Vertex and not from CRISPR, because CRISPR will just be taking the share of the profits and contributing to specified costs. But Vertex is going to be doing all these other activities to bring it to the patients. So we'll also have to watch what Vertex is doing and look for Vertex press releases and earnings releases. We have not covered Vertex so far, so I'm not very comfortable with Vertex. But when we cover a company like CRISPR, Editas, or Beam for a long period of time, we are aware of everything possible and we can understand the delta improvements or delta changes that happen due to press releases in the market. I don't have that comfort level with Vertex. So I'm going to start reading up on Vertex and see if I can bring that also into our checklist so that we can start seeing, being able to accurately predict the impact of what Vertex does for Exa-cel and how it's going to impact the share price of CRISPR. So friends, so that's something that I'm expecting either from Vertex in the Q4 2023 earnings or from CRISPR. And also what we need to hear from them is what is their strategy for manufacturing it in different geographies like UK and US and other places where it may be approved in Europe. And also to understand how they are going to collect the cells from the patients. How many centers do they have? What kind of tie-ups do they have in place? Is it going to be a cost center, or is it also going to generate revenue? So all those information have to come to us, and I think that's what I look for in the Q3 2023 earnings result for both CRSP as well as Vertex. So between the two of them, they have to give us this information, and that's my anticipation. So friends, I would like to hear from you about your thoughts on CRISPR. And if you have any price target in mind for the 31st of March 2024 for CRISPR, please put it all in your in the comments out here. And I really thank you for watching the video till now, if you have been watching. And that's all for today. Bye for now. I'll catch up with you in the next video. See you later.